This is the tragic case of Niño. Niño was the youngest of 5 children, born to Jacinta and Elias, a tenant farming couple living in a remote and rugged rural town in the Philippines, classified as a geographically isolated and disadvantaged area, or GIDA. Their small community was nestled deep in the countryside, accessible only through unpaved roads and reachable via tricycles or motorcycles, known locally as habal-habal. A single ride to the town center, or Poblacion, cost a steep 100 pesos per person, a luxury the family could seldom afford. The family's home was a modest structure of semi-concrete materials, a testament to their hard work yet limited means. Electricity was a distant dream, and their water supply came from a communal pump a few meters away. This pump served as the lifeline for multiple households, reinforcing the sense of shared struggle in their tight-knit community. Jacinta and Elias had little formal education, and their understanding of health concepts such as nutrition, breastfeeding, and family planning was minimal. Despite their eligibility for the government's Pantawid Pamilyang Pilipino program, 4Ps, a critical social assistance initiative, they were left out of the roster due to an oversight by the enumerators. This exclusion denied them access to vital support, leaving them to navigate their challenges alone. Niño's entry into the world was fraught with difficulty. Born prematurely, he was delivered by a traditional birth attendant, as access to trained medical personnel was nearly impossible in their area. Without the resources or guidance for proper postnatal care, Jacinta breastfed Niño for only the first 2 months of his life before transitioning to powdered milk, which she fed him until he turned 1. The financial strain of this feeding method, combined with the lack of proper sanitation and nutritional knowledge, took a toll on his health. Niño had never received any vaccinations, leaving him vulnerable to preventable diseases. Life in their rural town was a daily struggle for survival. Elias labored tirelessly in the fields, while Jacinta juggled household responsibilities with caring for her children. The family's meager income barely covered basic necessities, let alone medical expenses or transportation to the Poblacion. Visits to the municipal hall or rural health center, which provided the nearest primary care services, were infrequent and often postponed until absolutely necessary due to the prohibitive costs and logistical challenges. At 3 years old, Niño was a spirited child, but his small frame and frequent bouts of illness spoke of the hardships he faced. One day, Niño developed profuse diarrhea and a high fever. Concerned for his condition, Jacinta and Elias brought him to the nearby barangay health station. However, the health workers there informed them that Niño needed to be seen at the Rural Health Unit, or the RHU in the Poblacion. Without money for transportation, they were unable to bring Niño to the RHU immediately. Desperate, Elias approached the barangay captain to borrow money for the trip. By the time they managed to secure the funds, Niño was already on his 2nd day of severe diarrhea. When they finally reached the RHU, the nurse assessed Niño and recommended that he be brought to the district hospital, an hour away, for possible admission. The journey to the hospital was fraught with worry, and upon their arrival, Niño was immediately admitted. Unfortunately, the hospital's supplies were insufficient, and not all the necessary medicines, including IV fluids, were available. Jacinta and Elias were instructed to purchase these from a nearby private pharmacy. With their limited funds, they could only afford some of the prescribed medications. Niño's condition deteriorated despite the care provided. After 2 days in the hospital, Niño succumbed to his illness. Why did Niño die?